Hi everyone, this is a short video about hypertension or high blood pressure. This presentation attempts to simplify the complex details to help you learn more about this condition and how you can take care of yourself. Your heart is the organ that pumps blood throughout your body. Arteries are blood vessels that lead away from your heart. When pressures in your arteries increase, the heart has to work harder to pump blood through your arteries. Even if you don't feel symptoms from high blood pressure, it can increase your risk for heart attacks, strokes, or kidney failure. When you measure your blood pressure with a cuff, the meter will read two numbers. The first number is your systolic blood pressure, which is the pressure in your arteries when your heart is pumping out blood. The second number is your diastolic blood pressure, which is the pressure in your arteries when your heart is relaxed. When we treat high blood pressure, we typically want both the top number to be below 130 and the bottom number to be below 80. Common medications for hypertension include lisinopril, losartan, amlodipine, or hydrochlorothiazide, or HCTZ. These medications will either work in the heart, arteries, or kidney to help decrease your blood pressure. When you're treated for hypertension, you may receive just one of these medications or two of these medications that you need to take at the same time. It's important to take these medications every day. This remains the case even if you check your blood pressure and notice that it is under 130/80. That means that the medicine is working. Before you run out of the medication, make sure to get more at your pharmacy. If you are out of refills for the medicine, please call your doctor. These medications are typically well tolerated, but may have some side effects. We could perform blood tests to detect if we need to adjust the dose of your medication, if needed. There are other things you can do along with taking your medication to help lower blood pressure and risk of stroke or heart attack. It's important to maintain a healthy diet with less than 1 teaspoon a day of sodium. Focus on eating foods like whole vegetables and fruits, whole grains, beans, and nuts. Limit sweet drinks like soda, fatty meats, and canned and salty foods. If you drink alcohol, limit your consumption to 1 drink a day for women and 2 drinks a day for men. Adjusting your diet can be difficult. We can aid you with this and direct you to other helpful resources. Staying active is crucial. It's recommended to get 150 minutes a week of moderate intensity exercise. This can include brisk walking, hiking, or swimming. If you're overweight, aim to lose at least 5 to 10% of your total body weight. Once again, losing weight and getting adequate exercise can be difficult if this is not something you're used to. If moderate exercise is hard to fit in your schedule, try starting small, like taking a short walk before work in the morning. Everything makes a difference. So, what should your diet look like? To reiterate, avoid soda, fatty meats, canned foods, and salty foods. Prioritize whole vegetables, whole fruits, whole grains, beans, and nuts. Make it a habit to log your blood pressure at home every day or at least 2 to 3 times a week. If you do not have an automatic blood pressure cuff, we can supply one for you. It's recommended to take your blood pressure once in the morning before you take your medication and once in the evening before dinner. You should repeat your first measurement to ensure the reading is accurate, as the first measurements can sometimes be much higher than the second. Make sure to not have exercised or taken alcohol or caffeine 30 minutes before your measurement. You should also ideally rest in a chair and wait for 5 minutes. When you take the measurement, make sure you're in a chair, that your feet are on the ground, and that the cuff is on your bare arm. After your measurement is complete, record this value in a blood pressure log. One of these logs will be given to you at your appointment. Bring this with you when you visit the clinic again. If you ever measure your blood pressure and it's over 180/20, this is called hypertensive crisis. If you have this blood pressure level but are otherwise feeling fine, make sure to make an appointment with your doctor or Dawn Clinic in the next few days. If you're ever experiencing symptoms like shortness of breath, confusion, chest pain, vomiting, or blurry vision, go to the emergency room immediately. Hypertension is a very common condition among adults. You may feel scared or nervous about starting treatment, but getting help for this condition is the first step in the right direction. This may feel like a lot of information or even overwhelming, and that's okay. The Dawn Clinic Pharmacy team is always open to addressing any concerns you may have about your treatment or condition. If you have questions that were not answered in this video or need clarification on anything that was unclear, please reach out to us at your next appointment or contact us at pharmacy@dawnhealth.org. Thank you.